Just a little housekeeping before we get started. Kindly be reminded that mic should be mute at all times, switch off your camera, and recording is not allowed. And if you have any questions during the presentation, please type your questions in the chat box and our team will compile all the questions and we will bring it at the end. For your attendance confirmation as well as for the e-certificates, a link will be dropped in the chat box at the end of the sharing session. Okay, first, I would like to introduce myself. I am Nuramalina Binti Bohari, your moderator for today's webinar session, and I'm glad to welcome Mr. Eric Wu, our speaker for today's webinar entitled Health Technology Hazard. Okay, just a brief introduction for our today's speaker. Mr. Eric Wu has a remarkable background in healthcare technology management, as Mr. Eric Wu has joined Emergency Care Research Institute, ECRI, in February 2015 as a regional director. He is responsible in managing ECRI as Asia Pacific Research Initiative, operation management, business development strategy, and execution of project activities. Mr. Wu is a certified healthcare risk manager by ASQA and KEHO, and also the MBA holder. His 26 years of experience in healthcare include managing various medical technology, business in Asia Pacific, managing in private hospital, and research involvement in stem cell therapy for regenerative medicine. In recent years, he has provided solution consultation, trainings, and presentation related to healthcare technology management, policy and implementation to various groups such as healthcare authorities and regulators, hospitals, associations, and conferences in Asia Pacific. He has also been advocating the need in managing healthcare providers' risk toward patient safety by managing its people, process, and technology. And now, let's welcome our today's speaker, Mr. Eric Wu. And for those, without further ado, we will turn over to our presenter, Mr. Eric Wu. The floor is yours, please.
Thank you, Lena. Thank you for such a wonderful introduction. Welcome, everyone. I could not see everyone on the screen, but I'm glad to be invited. Thank you, Mr. Lau, for inviting me here to actually present and share some of the information that we have. But let me just pull my screen. It is interesting that this is the first time I'm joining an APTT webinar, and it's interesting that we can now share lots more with everybody. Maybe this is the positive effect of COVID.
Yeah.
Can you all see my screen?
So far I couldn't see. Yeah.
So
I can see the screen now, but can you please turn into the presentation slide?
Okay, can you see the presentation mode now?
Yeah.
Okay, so for those on the call, if you are seeing it slow or if you do not see my slides moving, please stop me, okay? All right. I know it's after lunch and everybody is feeling quite full. So please try and stay awake. It is an interesting topic. Top 10 health technology hazard is the kind of publication that we share free from our research to all healthcare communities and everybody who wants to read about it. So for those who really want to know more detail, get your hands on an actual copy of this particular article, you can go to ecri.org and then you can download it from there. Every year we will actually research for this and then we will publish it for free. And this is really just to give you an idea what it is so hazardous about from the technology perspective. Now, my name is Eric Wu. As mentioned, I am the director for ECRI in Asia Pacific. And today I'm going to talk about the topics. Now, before I go into jumping into the top 10 topic itself, for those who know who we are as ECRI, maybe this is just a refresher for you. But for those who want to know who we are and how we started, and why Mr. Lau have us into today's presentation or webinar, I'll just share very quickly who we are. We were founded more than 50 years ago by this gentleman, Dr. Joe Noble. That time he was an emergency physician. So he was complaining about resuscitator not working well in his hospital, but nobody cares about what he says. One evening, a 4-year-old boy was actually pushed into the emergency department, and he was trying to resuscitate the 4-year-old boy. Unfortunately, the resuscitator did not work, and the 4-year-old boy died. So that was the time when he got really upset, and he took this anger energy of his, and he, sort of moved forward and used his money, buy whatever those resuscitator that they have back then, more than 50 years ago. And they started to work with engineers and start researching on them. The findings of what he has done with that research was 60% of what is available back then are not viable for resuscitation use. He has finished the paper and he wanted to publish. No publisher wants to publish because he insists that all the models and names of the company be published at the same time, so that people who read that article understand which product works, which product do not work. So since nobody wants to publish it for him, he went to the Pennsylvania state government in the US and he asked for a small grant. And that small grant was actually the founding money that started ECRI. Back over the time, it was called Emergency Care Research Institute. For those who want to know what ECRI stands for, in the very beginning, it stands for Emergency Care Research Institute. And over decades of time, we have evolved our research work beyond emergency care. And you could appreciate that at the time he was an emergency physician. That is why he would name the research organization Emergency Care, right? Because the time he was working in emergency. But as we go beyond emergency technologies and we go beyond emergency devices, as we research that, emergency care doesn't really fit just what we do. We literally works on all kind of technology. So what you're seeing is a photograph of him. This is him, and this is the older version of him. And this device that you see here, how many of you know what is a crash cart in the hospital? And how many don't? I can't see, so I can't tell anyway. But this is called a Max card. It was the very first original prototype version of your today's emergency card. This was those days. So he actually designed these particular devices so that they can deal with emergency more effectively since the time, right? So this is him, and now this is sitting in, one is in our office, two more left. One is in our office, one is in the museum in Philadelphia itself. So those who want to drop by there, you want to go and look, you can go and have a look. So this is one of the innovation, but this is Dr. Joe Noble. He left us in the late 2014 because of cancer. A very quick milestone journey just to show you guys what we have been doing for more than 5 decades, right? So the founding time was actually 1968. 1971 is when we published that paper that I talked about, right? Then at that moment of time, there is something called a US FDA, food and drug, but there is never food, drug, medical device. So there's only food and drug. Until today, there's only food and drug, but no food, drug, medical device, correct? So those days we have food and drug, but food and drug do not take care of medical device, and nobody talks about the safety of medical device. Then his paper and his work landed in the Senate's hearing, and they wanted to know why we are researching on this. And with that hearing, the Medical Device Act was amended and then or created, and then it was added on to the responsibility of the US FDA to undertake all the regulatory requirement and safety requirement for medical device itself. Then, of course, we created a lot of information. So what you see here, these are information database that we created for people so that people can read. And in 97, ACRI is one of the 9, until today is the 9 federally designated evidence-based practice center. And this designation represents the importance of our organization working on research based on evidence and from an independent and fair point of view. So everything we publish are driven by evidence and facts. This is in 97. And in 2008, we became the first patient safety organization in the United States. And this is also federally designated. You cannot buy these titles or this designation. You cannot buy, you cannot apply. It has to be designated by the government. What is a PSO? Well, in short, ACRI receives all adverse event reports and root cause analysis from the hospitals in Pennsylvania state. Our experts will discuss all the root cause analysis report and adverse event report with the hospital, and thereafter conclude into a meaningful RCA or report before they are submitted to the Department of Health, United States. So we get our hands on the actual report and we work together with the hospitals to make sure that the reports are completed comprehensively and all investigations are done thoroughly itself. And that itself tells you how many already the thousands and thousands and thousands of reports that we have actually gone through with the hospital. Many involving medical devices, some don't, right? It can be processes, it can be practices and all that kind of stuff. So we are one of those in the United States that they have. I think there's 13 of us in terms of PSO in the US. Then in 2016, when everybody talks about genomics and genomics and genomics, and when sequencing becomes such popular, we started to make sure that we follow the development of this technology. We started a registry of all the kind of available genomic testing products in the marketplace and the companies in the marketplace. So since 2016, we've been collecting data and who is doing what kind of genomic research they are doing and stuff like that. So we sort of have a lot of information related to that, and we're starting to write evidence paper related to those genomic tests and whether it works, it doesn't work, what is the evidence like and stuff like that. And those are coming already soon. And if you can see, 17 and 18, these are some of the other sort of products information products that we created so that people can read more about it. So you've been hearing a lot of devices and technologies since 1968. And we felt that the missing piece, which is really medication. We have not been working on safety of medication from the past. But now, because of the affiliation and the acquaintance now with another group called ISMP, ACRI is now looking at more of the similar pattern of risks and issues, but related to medication safety. So now we have abundance of data related to medication safety, and then we have abundance of data related to medical technology safety and stuff like that. And if you go to LinkedIn, you will be able to see some of our posts today. And one of it that is that I've reposted as well is from ISMP. A nurse is now being blamed because medication error, the patient were harmed, and now the nurse is in court, probably going to be charged. And probably jailed and had her license removed and stuff like that. What is it that has caused that? It would be really interesting if you can go read that kind of information as well. So that's on medication. Now, globally, ACRI is housed in 4 locations. Philadelphia, where specifically in Plymouth meeting, is where our head office is. This is an old building photograph. We have now built all the way up. If you can see, my arrow is now up the tree. The tree cannot be seen anymore. We have now built a new building in that Philadelphia area. And next time around, I'll share the new facility videos with you and all that. That's it. That's our head office. And then we have a European office outside of in London, in Hartfield. It's not so far away from London. This office, our American office, our head office takes care of the North and South America region. The European office takes care of the Europe and Middle East and Africa region. In the Middle East itself, we also have a semi-office, which is a joint venture with another organization in Abu Dhabi. That is in Abu Dhabi. That's our Middle East offices. So, but the European office undertakes that whole region itself. And here is where we are, Asia Pacific. And we are located in Sunway, right in front of Sunway Medical Center. So those who know Sunway Medical Center, we're right in front of them. So we have other partners outside of this country as well who's working with us, just to give you a flavor of where we are and our offices that we do. Right, that's ACRI International Office. What are some landmark things that I like to share? We have many things, but I don't think I just want to sit here and brag about who ACRI is and what we do. But I just want to quickly bring you to some of these engagements that we have. People ask whether we work with FDA. A lot of people ask us that question because we're in medical device, right? And FDA sort of like rules and looks at the rules and regulations for medical device. And people always ask us the same question: do we work with FDA? And we can tell you yes. One of the latest one that we work with FDA is on medical device material safety research. We actually look at the kind of material that is submitted to FDA, and we actually talk about, and we have published this paper as well, together with FDA, and we talk about what are the safety in terms of the material used for medical device. Someone wants to ask a question? No? Okay, I shall continue. Right, so this is one of the information I'd like to share, things that we work with FDA, right? Other collaborations that we work with, collaborations as in we have an MOU with this party, and then we share and we work together in sort of improving the healthcare services that we have, both from the engineering, clinical, and all that, right? So MSQH, I'm pretty sure a lot of you know who MSQH is. They are our accreditation body. So MSQH and ACRI has an MOU signing. We just concluded another webinar sharing yesterday that we talk about telemedicine and all the other issues related to telemedicine and needs that we want to have. And then on your right-hand side, you can see this is the Biomedical Engineering Society of Singapore. This is Professor James Goh from NUH. We have this strong collaboration with Singapore Biomedical team. There are not many of them in Singapore, but the wonderful thing is that we keep on having engagement. One of those things that I just did with NUH, right? Yeah. So we just had a training with them, and they learned about how to investigate a medical device accident related in a hospital when it is related to a medical device. So when an accident happened in a hospital, patient die or patient harm, and a medical device is involved, what do you do? How do you investigate? Other affiliations you can see in the region is just not in Malaysia, but again, UM is here, University of Malaya. So we have this collaboration with the engineering faculty where the biomedical people are. We also have a collaboration with King Mongkut University in Thailand, to also engineering faculty. And then we have also MOU signed with Polytechnic Kesehatan Kemenkes in Jakarta. They're also a conglomerate of what do you call a consolidation of engineering faculties from various polytechnics in Indonesia or in Jakarta per se. So we create all these collaborations because we want to see how we can actually work with academics and academias and association to uplift what we're doing and manage medical device safer in the healthcare environment, right? Now, spend 15 minutes talking about us. Now I want to talk about the topics. Okay, so today you're here to listen about what is the top 10 health technology hazard that we have published for 2022. And every year we have one published, so you can download for free. So let's begin. This is just an outline. We will talk about the purpose of the list. What is it? Why do we create this top 10? What do we think about when we sort of work on this document? How do we decide and all that? So what is new in 2022? Then we're going to go into a closer look of the hazard, and that is where you have more slide decks to see. And then finally, what are the additional information you can get from that? Right. So the purpose of the list, this is designed as a hazard list. This hazard list would have some incidents that has happened, and it could if it has not happened to you, it can potentially happen to you. So this is why this list is important, so that people within the healthcare community can actually now learn and understand the various challenges that are happening or various issues that are happening, and that you, after reading this, may want to take precaution, especially if you're working in a hospital and what to do with this sort of technology, right? Now, the way we look at the topics, this is important because people always ask us, did you just pick the topics for fun, and did you just get it from, one day you wake up in the morning, nothing to do, and you just thought of that topic and you just decided to write? No, the idea, we didn't do that by that. Everything is based on a structured methodology to derive to that, right? It has to be a known event. That means they must have already problem reports. They must have already issued. And like I said, the reason why this is a hazard report means the event has already happened somewhere else. It's hazardous. It's hazardous to you if the event has not happened in your hospital or your working place yet. And you would like to take note of it so that you can do something about it. And that is the reason why we are giving this out for free. As a non-for-profit organization, we wish, and it is our mandate to hope that, our healthcare facility and all our medical technologies are safe for patients. And patient means you and me. One day, you and me will have to use the healthcare facility. It's not a joke. It's not a curse. It is a reality. You like it, you don't like it. One day, we will be a patient, right? It's also to talk about some of the emerging issues. Now, it may not be the most incident that happens, but it is a new thing that is happening, and it is going to be a big problem. And with this hazard report, we want to highlight it so that you can now know. It's like the first ever COVID patient. Everybody wants to know where the first COVID patient is and everything like that. So you would want to know. Similarly, with incidents or issues that are happening with emerging technology, you would actually want to know, and so that you can take precaution of what is going to come forth, especially with some new issues that never faced before, right? Testing of medical device, once we have tested them in our lab, we found that when we are testing those devices independently, there is a problem. We also want to highlight that in this particular report. So essentially, something that has already happened all the time, something that is new, never happened before, and then something that we have found when we researched them, right? So these are the three components of how we derive to the top 10 type of events that is happening. So you will see some issues that we are highlighting, common issues or common devices that you are aware of, or you already know, and you're wondering, why is this still in the top 10 hazard? Because a lot of problem is still happening from the same old items that you see. Some of them are very new and exciting, and some of them are what we find from our research work in the lab. Right. So some of the criteria, I shall not dive into the details. If you want to read more of the criteria, you can download the report and you can go into the details of that. Right. At glance, this is what we get. This is top 10 2022. 1, cybersecurity, supply chain shortfall, damaged infusion pumps, inadequate stockpile of your emergency supplies, telehealth problems, infusion pump failure, AI problems, duodenoscope reprocessing issues, gowns that are not correct, and then you have Wi-Fi. So there are certain overlaps here, and I like to caution you. Now, I have actually merged some of these overlaps. For example, I will talk about supply chain shortfalls and inadequate emergency supplies in your hospital together. And I will also talk about the pump issue, damage of infusion pump, and also the failure to adhere to syringe pump practices. They are two different things. They're actually two different things, but I like to talk about them together. And if you can see, this is about damaged infusion pump. This is about failure to use the best practice. Hello? Hello? Am I supposed to stop presenting? I think Mr. Ahmad Zawani is requesting to stop presenting.
Oh, no, just continue.
Okay, okay.
Yeah.
All right. So, so number 6 is failure on the to adhere to syringe pump practices. So practices means someone who is supposed to use the pump properly and did not use the pump properly. This one is damaged pumps. So there are two different issues, but I'll talk about it together. And then there are things that are repeating, such as duodenoscope, and please do ask me if you don't understand what duodenoscopes are. If you do, jolly good, then we'll talk more about that. So in a glance, these are top 10. I'll dive into the details now. Oh, by the way, this 10 has no sequence, yeah. It doesn't mean number 1 is the most important, number 10 is less important. They're all the same importance, yeah. Not number 10 most important, number 1 least important. No, no such thing. They're all the same level. It's just that we are just taking it as a number. So don't bother about the 10, 9, 8, 7. But let's start with the first one that I'm going to talk about, which is number 10. Wi-Fi dropout dead zones can lead to patient care delay, injury, or death. It happens before, and it will still happen. And
Mr.
now,
Ray,
yes, can you see the slide?
we have 2 guests raise hand just now, Kamaru Zaman and Noli Santap.
Okay, if that is there a question you can ask, then I can try and answer. I couldn't see the chat box.
Yeah, any question? Noli Santap?
If they want to ask a question, they can. I can stop, no problem. It's good. It's more interactive. I like that.
Excuse me, Noli Santap? Do you have any question? Because you just raised your hand now.
If they have a question, I can answer now. Let me try and see if I can see the chat box.
Yeah. Oh, already answered because I thought it's sequence. Okay. Actually, we have also, one question from Mr. David. How about MDA?
Okay, what about MDA, Medical Device Authority? Yeah. So we, yes, we work with, we don't have a direct continuous work with Medical Device Authority, but they know us very well and we know them very well. On top of that, I mentioned, right, we are doing research on medical device. The only thing I forgot to tell you guys is that there's only 2 labs that does, 2 ACRI labs that does independent research on the medical device globally. The original lab is in Philadelphia, where I show you. The second lab is in here in Sunway. So our lab will bring in, our research lab will bring in medical devices that are not approved in Malaysia, and we will bring them in for research. Once we finish research, we will send the equipment back to the manufacturer. And this, we do it with the blessing of Medical Device Authority. We have actually spoke to them and we have an understanding that this is what's going to be. So that's what we do with Medical Device Authority. Medical Device Authority at times will also come to us and ask us if there's any major issue with this device, do we have certain information? The other thing that we do in Medical Device Authority is that I also have trained them twice on how to investigate a medical device that is related to an incident or an accident in a hospital. So that's what we do with Medical Device Authority as well, especially in the post-market surveillance perspective. Okay, any more questions?
I think you just continue.
All right.
Yeah.
Wi-Fi dropout. So people always feel, and I'm glad I've been talking about this since 2016, Gert. I think I've been really talking about this particular issue for a long time, not just today. I am very glad that our colleagues and our research team has thought about Wi-Fi being a problem now, and we started to publish that. There is an increased number of medical device type, not just device quantity that you have, but type, that uses wireless channel to transfer data. Do we agree or not? If we agree that there's continuously this many medical devices are being used that has a wireless feature to transmit data, and we know that transmission of data is essential and is part of our care within the hospital itself. Now, we regulate and we look at the medical device. We regulate the process of how the people actually maintain, and also those people who actually use the device and care for the patient itself.
Survive.
Okay, thank you. Now, is Wi-Fi device a medical device? Now that we know that Wi-Fi is so important, right? All this Wi-Fi is now so important to us, but is the Wi-Fi device, i.e. the router, is it a medical device? Nobody will want to answer me, because if I'm talking to my son at home, he will tell me a router is not a medical device, it's a router at home. It's for me to use Wi-Fi, it's not a medical device. But how you know very well, if your Wi-Fi fails, then your medical device cannot transmit the data, which also means your patient can be harmed. So think about that, right? So there are wide varieties of equipment. These are just some of the examples that you can see that are transmitting, and these are the equipments that you use in the hospital as well. And you're trying to repair them and maintain them all the time, right? Your ECG machines, secondary alert system using the phone. You have the MR, the MAS system, then you have telemetry, importantly telemetry, plenty of telemetry. You also have other devices that we use in the hospital that uses the Wi-Fi in the hospital itself. And commonly what we see is that it's either the Wi-Fi bandwidth is not enough, or it is actually obstructed by buildings and we didn't think about it. We also never thought about if the patients are going into area that there is no Wi-Fi connectivity or there's no router there, and then all the devices are going into an area where the Wi-Fi connection cannot be established. So these are all issues that we can talk about. Those are technical issues that you see today. But ladies and gentlemen, let me also bring you to another new issues. Wi-Fi is your open source for cyber security or cyber attack. Do you know people who sit in your lobby of your hospital, connect to your hospital Wi-Fi, can actually hack your hospital medical device? This has already been tested and done before. So even though using Wi-Fi, other than the problem with low signal, inadequate signal bandwidth, out of range, poor maintenance, all that are, today we know the problems that we know. The problems that you want to know in the future is no matter how good your maintenance are, you will probably have cybersecurity problems. And I'll talk more about cybersecurity later. So then in this issue, I just want you to take note that jikalau your Wi-Fi is out and your medical device cannot transmit, there is a chance your patient can get harmed. To a certain extent, may die. Imagine telemetry transmission. If that one failed, what happened to your patient? So that is why it's one of our hazards that we have. And we want to talk very quickly about what we should do to try and prevent this particular issue from happening again, right? So prioritize where your communication device are used. Then you will prioritize your Wi-Fi allocation. If the bandwidth tak cukup, then you prioritize where you want to use, where the device that has more connectivity are, then you send all your signal and bandwidth to that area, right? That's so simple, straightforward. So you want to really think about where that priority is. The second one is really to test and test and test. No matter how good you are, we still have to test it. And the problem is, this is not like our home Wi-Fi. Kalau kita watch Netflix at home using Wi-Fi, and then the Wi-Fi slow down, then your Netflix got hang, then never mind, you can stop watching the movie and come back again. But if your Wi-Fi got hang in the hospital, especially in places like a telemetry ward and all that kind of thing, it is about your patient's life that is in trouble. So you got to think about it. No matter how many times you do maintenance, I still suggest you continue to test, test, and test. And even if it is not maintenance, you should actually do an additional periodical test at least to see the Wi-Fi capability, whether the connectivity, whether it is strong and is stable or not. Very important, right? We talk about maintenance. Now, the other key thing is to involve your clinical staff. Technology itself is not about the technical people per se. The engineers and technicians are fantastic people, but you cannot manage the device and say it is in the best situation and patient will not get harmed, because the clinical process plays a role too, right? Make sure the clinical staff understand. Jikalau the bandwidth tak cukup, you have to tell them, hey, don't open this door and pass this door. The bandwidth can only manage until this door. If you open this door, you are going to risk the patient cannot, the connectivity of the device cannot happen. So make sure that people understand that you know doesn't mean they know. So it is important, it is our job to ensure everybody is aware, everybody is involved, is aware of that particular situation, right? And communication is the best and the best strategy to do. Make sure you communicate clearly, provide them with the clear information. The technical information, sometimes they tak faham, but you still have to tell them and make sure that they understand, right? So that's number 10 on Wi-Fi. Please take note because a lot of people forget to think about Wi-Fi. They always think Wi-Fi is not important. It's just another Wi-Fi. But let me tell you, Wi-Fi is very important. So think about it. Number 9, disposable gown. What is with disposable gown lah? Why is it in our top 10 list? Okay. Long story short, there are many types of gowns. There are many standards that is required for gowns. And what is happening is a lot of front lines, even including the engineers and technicians, did not understand what kind of gowns are meant for what kind of use. So the story here is this is also because of COVID lah, and there's shortage of gown everywhere in the world, right? People are buying gowns for the sake of buying gowns, and they may not be using the correct gowns, especially the front lines, but they do know lah. But what happens if the buyer, the procurement fellas, they see gown, they buy because there's shortage in the marketplace. Buy back already cannot use. It's not the right gown. But how you got no more of the proper PPE gown and you have no choice but to use, you will still use, right? At least there's something to gown. So the story here is that there are gowns that are not meant for COVID kind of patient care. So you got to really think about it. And if you can see here, my colleague has put together a very nice, simple illustration diagram on the right-hand side. This is called an apron. And true, I just want to highlight this. This is not a gown, it's just an apron. This is a hazmat suit that is used for fully secured, right? This is a gown. This is a gown, how it looks like for surgery that we have to go through. And you can see there are variation types of protective equipment that we use. And getting the correct one is very important. So what we see is the procurement fellas sometimes didn't understand, and because of the shortage and the worry of not having some gown for the front line, they just buy and grab. And people who buys and donate, they also didn't know, they buy and simply donate. They thought they're doing a good thing, but they're also not providing the right thing. So not understanding this is a problem. So you got to really make sure that you select the right things, understand what it is meant to do. Also look at the materials, and because of the emergency situation, global emergency during the pandemic, there are people who sell things that are cut corners. They may not meant for, the quality hasn't reached that standard. And actually for gowns, there are standards. So some key recommendations you want to take home when you look at gown, make sure you look at how, make sure the infection control teams understands it. Evaluate your gowns, understand what is necessary, what is not, and make sure those are identified clearly. Communicate that with procurement team, communicate that with everybody. And for engineers, if you are going in to service ventilators in a COVID-related ward, then you need to know what you need to do to protect yourself as well. Good understanding of the properties. We're talking about the quality and the material that they use. And then not all gowns are fluid resistant. You have to know that. So you've got to think about what gowns you're wearing. And these are examples of some standards that you can apply to help you sort of understand what kind of gown quality standard you want. So these are some of the 3 standards that you can refer to. Okay, I've talked about reviewing the gown's current availability, looking at your standard, buy properly, don't wait until the last minute, buy things that has been verified, understand the quality better. I've talked about that already. We also try and tell gown manufacturers, or we also try and caution manufacturers. I think the very branded type of manufacturers for gown, they understand what to do. For those who have no choice but to buy from somebody we don't know and never hear before, and they seem to be able to produce the gown, you just need to be a little bit more careful And of course, standards and quality outcome is important. So we hope that all manufacturers are also providing that kind of quality for people itself. So that's number 9. Okay. So that's on gown. Duodenal scope. This is not the first time we talk about duodenal scope, people. I'm just going to say this. And poor duodenal scope reprocessing and ergonomics and workflow put healthcare workers at risk. So we have published duodenal scope problems for quite some time. And this is not the first time we talk about the problem. I think this since 2015. Yeah, there you go. FDA has issued safety communication since 2015. So for those who wants to know and for those who understand what the duodenal scope is, jolly good. For those who don't, very quickly, it is a very, you can see here, it is a flexible scope that is actually being used to look at your duodenum area from the mouth down. So that we can do diagnosis through an endoscopy device, right? Now, the problem is that the scope on the front tip here has been storing a lot of bacteria. And when you use on patient A, and then next round, they take it for cleaning, they thought they clean, and then they use it on patient B, there have been many report cases, and if you can see here, since 2015, many report cases that the scope has transmitted the bacteria or virus from patient A to patient B to patient C to patient D to patient E and so forth. So no matter what they say about cleaning, it is still transmitting. So there are big problems with the use of this particular scope. It's not about just the work, the people or the colleagues in the hospital and the technicians who service and clean it, or the CSSD who cleans it and all that kind of thing. It is the design. That's why I say when we buy medical device, we got to understand the design. The design is difficult to clean. You need a PhD doctor to sit there and learn how to do cleaning. Then only you know how to clean this particular device. It is very difficult to clean. And because it is so difficult to clean, you will never be 100% able to clean it. So it's a design fault. It's not the human or it's not the process fault. Now, because they have sold so many of this in the market and we have buy so many of this in our hospital, and it is now known already, people publish this in 15, 18, 19, and 20 as well. Everybody is complaining about the cleanliness and so scared about it. The hospital tell the colleagues in the hospital, especially the CSSD or the cleaning nurse in the endoscopy suite, please see this thing properly. Please wash this thing properly. And because of the demand that so difficult to clean, and it is really now not just the patient that is not safe. Now our colleague Pula is not safe. They're getting tired and fed up with this because it's so difficult to do. And bear in mind, right, it is not easy for everybody who learn how to actually process this device properly. And it's now becoming a big hazard. And what should we do? So I'll talk about the problem, the TTS. Right, this is the issue of the problem. If you want to see, sorry, I should have shown you all these photographs. These are also sort of the problem. They have equipment to clean, but still cannot clean well. You can see there's reprocessing equipment to clean, still cannot clean well, right? So you have to think about that. So some of the recommendations that ACRI has put together: assemble a facility performance improvement, look at what needs to do, look at pre-planning, creating more time and space for the people to clean it. Maybe you want to assign more people to do the job and rotate them. It is not easy to clean. It is very difficult. If you look at this, you have to open everything up and then clean the inside of things. It's just not the outside part. So cleaning is just not using your disinfectant and wipe it. So make sure that we have a good process to help ease the workload and the challenges that the worker has when they are cleaning this particular scope itself. Monitor how that new process works, put in an additional resources to do the job, and stuff like that. So look at all, review and develop a plan where you can address all these problems safely. And all these are just general policy recommendation. When it comes to reality, the only way to deal with this is really to make sure that we have sufficient staff, we have a very clear, simplified process, provide them with the correct tool, then they can do a good job. Give them enough time. If you demand that your scope, that means now let's say your whole hospital baru ada dua, one here and one there. If both of them are being cleaned and being processed, you got no scope to use in your endoscopy suite. Then management don't kill these people for rushing to clean the thing, but you got to, the idea is for you to come up with a plan. Go buy another one, buy a third piece, buy a fourth piece, so that you can make sure that this cleaning process are done thoroughly, and at the same time provide enough sufficient time to support those people to clean it. So this is the problem with the duodenoscope issue, right? So really have to figure out the best way to clean. And some of our recommendations go down to the level of the height adjustable cart and sink. So we even think about this ergonomics, which I think, you know, necessary, but more importantly is to make sure that you have sufficient people, staff, sufficient cleaning devices, and then sufficient time for them to turn it around, not to rush and everything. If you want the scope to be thoroughly clean, and then so that they are not, the team members are not stressed as well. Okay. Now down to number 7, artificial intelligence. Very important. Everybody likes the word artificial intelligence. I tell you, artificial intelligence is nothing more than algorithm that we study in mathematics in our studies those days. It's all about algorithm. So we all know what AI is, right? So I don't have to really go and explain the detail of artificial intelligence to you. But this time round in our top 10, it is very specific. There are many AIs in the hospital itself, but we've talked about those. And I just want to, this time around, we're going to talk specifically about reconstruction image can be distorted. That means the device will reconstruct a scanned image into 3D lah, identify automatically where the tumor is lah, and stuff like that. So those AI-based software in the device can help you do that kind of stuff. So we want to talk about what is the problem that we now see with those kind of software in your ultrasound lah, in your CT scanner lah, your MRI lah, stuff like that, okay? So we want to talk about what are the problems that we see with that particular thing. Now, small little, okay, this is a good diagram to very quickly explain. Can you see this diagram on the right-hand side, this little photograph? Can you see how many multiple anatomy that is cutting down when you reconstruct? So any small little change in one section of the anatomy that cannot be captured properly or cannot be scanned properly, the algorithm will utilize what they have in the database and reconstruct for you. It may not be exactly the truth. And I can give you a simplified version of, it's not the truth, yeah, simplified version of what I'm trying to say. And this happens to me very, it's a real case that happens to me and my father-in-law. I will not tell you which hospital, but I will tell you what happened. He had stroke. He was sent into the emergency department of a public hospital. And they went in the, you know, now it's COVID, right? So they triaged him outside, but they went and, because he fell down when he had stroke, they sent him into an x-ray and the x-ray came out. They say his sacrum area has a lot of gray color picture, looks like cancer. Looks like cancer. I said, and it was late. So I told myself when I hear the news, that is impossible. If he has cancer, now he's crying for pain. Even though after fall down because of stroke, he's not complaining that his butt is painful or anything like that. So what we're saying is that the image that is captured by the device may not accurately represent what it is, even though the artificial intelligence software is supposed to do that. This is a 1, 2, 3 hours explanation that I need to sit down and explain why it may have a problem. So in the next round, if we have a chance to sit down, I'll explain why that is a problem. But long story short, you cannot 100% trust the artificial reconstructed image. Yes, the manufacturer has actually designed a very good system inside, but we still cannot 100% trust because we have seen information or reports and issues related to those outcomes itself. Does it happen to one company or 10 companies? I shall not talk about that. If it can happen to one company, it may have a chance to happen to 10 different companies who has an artificial intelligence built in. The whole thing is about the kind of sample that they use and the kind of information they use to train their artificial intelligence. So key thing, if you are the technical team member or if you are buying an artificial intelligence device, make sure you understand what was the trained AI that they use. Not only that you want to buy a device that the AI is trained, usually they will tell you it is trained. And I'll explain more if you want to know more about what is a trained AI. But you also want to know how they train and using what data do they train the artificial intelligence. So you really need to understand what you're buying and what you're using. Understand your risk. When there is a use of the technology, what kind of problem can happen? Understand your risk, making sure that you have enough tools to test the performance and test until you are comfortable and you are sort of satisfied with it, then only you start using it on a patient, right? So these are some of the key recommendations that we really want you to think about with artificial intelligence. Now, I said just now I will combine some of the topics and I'll tell you the stories about some of the topics related. Even though this is infusion pump and also syringe pump, they're pumps lah, but one is infusion, one is syringe, right? The bigger one and the smaller one. Okay, so that's the difference. On number 3 is that damaged pumps can cause medication error. This is everybody knows, and everyone on the call with me today actually will already understand that, of course, damaged pump is going to cause medication problem. But we're still highlighting in 2020 why. Maksudnya is still happening lah. There's still many of these cases happening lah. Damaged pump also continue to use and continue to cause medication error. It's an old problem. This one everybody knows. Kalau rosak, damage, and everything, it will make an error, and it will not infuse properly on the patient that you need to infuse. Problem is, it's still happening. It is still continue to happen. Damage, fix lah. Don't let it go back to use, right? That's number 1. The second part is people, this is not just the pump, yeah. Failure to adhere to syringe pump practices means there is a process to press which one, how to do the setting of the flow, how to look at the what you call the dose and all that kind of thing. Now, if you fail to follow the proper process of dealing with the syringe pump, of course, you're going to cause error. You're going to have more problems with the error. Patient will get the wrong dose. Patient will get the wrong flow rate and all that. So you will have problems with that, right? Time is cutting short. I'm trying to rush through this. So these are examples. I'm not going into syringe pump. These are examples of the syringe pump. The problem I've mentioned earlier as well. You can see there's a low flow rate issue, lag time, and all that kind of stuff. So if it is if you don't follow how to use the syringe pump, you are going to cause a problem. You're going to cause a problem for your patient itself. So how does this happen? Let me just bring you back to this. This is 1 brand, 2 brand, 3 brand, 4 brand, 5 brands, so many brands. They all do the same job, but the buttons are not all the same. The way you key in the information are not all the same. In a general hospital where you have nursing people turning around and rotating and rotating and rotating, sometimes they learn this machine. Tomorrow they learn this machine, but they never learn this, and they thought it's the same button to press on this one, so you cause problem. So you will have issues with that as well. So you got to think about that, right? So we talk about from the pharmacy adopt standardized drug. Make sure that, of course, from the pharmacy perspective, make sure people can read the drug properly. You don't select the wrong drug and everything. Nursing, making sure you actually train the nurses, even though you will have rotation of nurses, train them how to use it. Technical team, please tolong go and explain to them the problems that you see with the pumps and tell them how to behave the pumps. Don't just press and chucho like that. The thing will get spoiled and then the machine don't function well. Then they blame that you never maintain the device properly. So please talk to them properly. Educate the nurses how to properly use the syringe pump so that they understand how to deal with that part as well. Infusion pump, I talk about that, damaged infusion pump, right? So these are common damages. I just want to highlight this to you. The door to the infusion pump, the hinges, the latches, the connectors, the chassis, and battery. Now, battery, please tolong, look at the battery. If you're plugging on the wall all the time, it's fine. But if you do not understand your battery lifespan, then that can be hazardous. And one day, if you do not have power and you have to use the battery to actually continue the infusion, and you're not aware of the battery's wear and tear, then you've got a big problem. So think about that. Okay, these are very simple mechanical elements now. If you don't use a microscope to see during your maintenance and it's already being damaged, and if this is not part of your protocol to look at from the pump, right, you will never find this crack. If you don't find these cracks that is happening in the pump itself here, your pump may fail and it may be damaged and fail and cause problem in the infusion that is supposed to do when a patient is using it. So sometimes you have to think beyond and understand what can happen and what not. So from the maintenance perspective, you may want to think more about it. So key recommendation, so maintaining your pumps and everything is just not the engineers and the technicians' work. Making sure that we don't have harm to a patient at the end of the day requires a collaborative effort with everybody. And to a certain extent, we also want the pump manufacturer to play a role. Do a continuous CME program to teach new young nurses how to use your pump. In the hospital, there are 5 different brands of pump. Takkan everybody wants to remember which pump. So more often than this, the manufacturer should come and help to actually convey those messages and share. Now you look at the second one that has a double that looks the same. Supply chain shortfalls is a big problem, especially during COVID time. Inadequate emergency stockpile has a direct relation to supply chain shortfall. And I will go into some of the details very quickly. We start with number 4, I think. Yeah. Inadequate emergency stockpile. So during COVID time, so this long story short, the issue is that we have issues trying to provide medication, PPEs, consumables, ventilators, monitors, breathing circuits. We have issues trying to provide that for our frontline and also our patient. You know, pumps that has been continuously being used until battery also cannot be used. And when you want to use your backup batteries, they are all expired. Charge also cannot use. So these are things that we have to talk about. We have to understand, and you can see many of the reports that has talked about supply problems and lack of all these issues globally, not just in one country. So it tells us that we have to give it a thought. No more that we can sit down and think about, oh, when emergency pandemic happened, then we go and figure out how to deal with. By time come again, you got shortage, this and that. And this one result to frontline can die, patient can die. So you really also want to think about the challenges. So if there's a supply chain shortfall, there are many things we have to think about. Think about the inventory, think about the vendor standardization. And this has been what we do before, right? Last time when we buy things, we tell the procurement, hey, try and standardize, buy from one company, get the best price and the best quality finish. But now you understand, right? 3M cannot supply to the whole world. N95 also cannot get because United States say, oh, all the N95 has to be kept in the US and be used by the American front lines only. 3M cannot supply to the other part of the world. We all hear that story before, right? So when we try and tell procurement, hey, you got to standardize, buy from the best company, best quality, best price. That is something we now have to think about because we have now experienced pandemic and it's no longer something we can sort of avoid. So how to run away from supply chain shortfall? Make sure you study what is critical, identify your suppliers, and look at what are the type of supplies you need, from medication to PPEs to consumable medical device consumables, to a certain extent your capital equipment as well. Now, we cannot buy everything and keep stock. I cannot buy 100 more ventilator and keep in my warehouse and wait until the next pandemic happens. I cannot do that, right? Nobody will want to do that also. But you got to figure out a plan how we can maneuver around and make this work. It's a consolidated effort, and you've got to talk to the respective authorities within the hospital. You have to talk to your state health. You've got to talk to the different manufacturers and how we can design a methodology to manage such pandemic shortfall. So once you talk to them, you look at the policies and procedures. So when we want to now plan for the next pandemic, what should we have? Where should we keep them? Should we standardize where we are going to care for our patient? What should we use? Who should use the PPE first? And stuff like that. And all this have to be thought through, right? And all these things have to be thought through just to get ourselves ready for the next pandemic. I think if there is no pandemic up to today, we very rare have this problem. At times, I see the hospital buy too many sitting in the store until rosak, until expire, until expire also cannot finish use. I see gloves throw into the dustbin. I see throw into the corner. One box not finished, the next box open. So we see a lot of that those days. So I don't think we have a problem on shortage those days, except for pandemic. So we need to really think about how and what we want to do during pandemic itself. Number 5, telehealth workflow. Many people tell me, and yesterday during MSQH Punya webinar where I presented as well with other colleagues who have presented, we had a fantastic discussion on telehealth. It is not so fantastic, honestly. Let me just tell you the story behind. Telehealth is not new, yeah, and we want to recognize this. I can use WhatsApp to call you and video call. And if I'm a doctor, you're a patient, that's telehealth. I can use a phone WhatsApp to send a photograph of my injury to you, and then you can see the injury on the picture, and you can tell me, oh, you need to wrap it up now, or you need to put some ice. That's also telehealth, right? So everything that you can do on a video to communicate can be a telehealth. Then people say remote monitoring. Okay lah, put a vital sign monitor at home, put a physiologic monitor at home. I boleh duduk in the hospital, I can see what you are. But there are so many problems to it. You have patients' compliance lah, whether they are wearing it correctly lah, whether you're getting the right information or not lah. All this will happen. So telehealth is not really super duper like what people say. And when they say during COVID time, telehealth is so good and it's so wonderful. Yes, because why? Better than nothing. At least I can talk to a doctor. He can give me some form of advice. I can do some basic treatment. Belum mati, better than nothing. Yes, during the kind of time when we are locked down, we are sitting at home, cannot go out, and we have an issue, talking to a doctor, give us some psychological comfort, better than nothing. So when it is better than nothing, telehealth plays a role, but to only a certain extent. Now, what are some issues we see? We want telehealth to be fantastic. I really hope that telehealth can be one of the mainstream healthcare so that not all patient is going to go and cloud and go and sit there in the hospital, wait, right? But we still see that there are issues with telehealth, right? So number one, some facilities can't even now. Well, number one, I think your hospital staff has to be ready. Do you have a person or a doctor who's willing to sit in front of a camera like this lady here on the screen and talk to patient and provide the necessary advice or not? Or do you have a staff nurse that is sitting in front of the screen to do that or not? So even during pandemic, we hear so many cerita, our frontline colleagues cannot go home lah, 1 month never go home lah, 2 months never go home lah, 3 months never go home. They are just in the hospital. Every day, morning wake up hospital, night sleep hospital. They never go home. So do you think they have time to sit in front of the camera and chit chat with people? Who are the people who could use this? Did we identify the right kind of people to use this kind of technology? So there are issues related to whether we have enough and sufficient manpower to actually manage um, um, what do you call the telehealth system that they have, right? Um, we also look at technology. We can provide everything in the hospital. Ministry of Health can use money and buy everything in the hospital. You can have the most canggih cameras and softwares in the hospital. But does your patient have it? And then what about blind patient? What about deaf and mute patient? And what about uncle and aunties who don't even know how to use a WhatsApp to send a video call? So how do we leverage on this technology and how do we make it work, right? Even if we can, our recommendations here are to tell the hospital to standardize their communication platform, make sure there's a proper infrastructure, make sure there's a clear patient selection, and all this. These are good recommendations from ACRI. Investigate ways to improve provider experience. This is the part they say, oh, we have to find a way. In our recommendation, we even say we have to find a way to make sure that the provider can provide those necessary care for the particular patient. But we have many problems. We still have many problems. Uncle, auntie do not know how to use the device. The people who are deaf, the people who are blind also do not know how to use the device properly. They can't. They will never be able to enjoy. And then, does everybody have the same technology at home? Now, when even if you can jump on a WhatsApp call and you're talking to a doctor face to face, like now you can see my face, I can see your face. The doctor says, can you do a pressure, check your blood pressure now and show me what is the blood pressure? Apa itu blood pressure? How to check? What kind of machine you want me to check? What also don't have. How lah you want to check? You cannot tell me your blood pressure. Then how I know what's happening to you? Do you know what's your temperature or not? Ayo, I got the thermometer last time I put under my armpit one can. Can I use that thermometer I put under my armpit one? Then to test my temperature today. Does the patient at home has all the toys and tools so that they can give you certain diagnostic answer or not? If you don't have this technology, telehealth technology, if you use it, if it doesn't benefit, it will be a waste of time for both the patient and the provider. So you got to think about that as well. And this is the first one and the last one we have, cybersecurity. I don't have to define cybersecurity, but I'm pretty sure all of you know cybersecurity. Let me tell you that in our medical device and all our medical technology, particularly today, like your handphone, who knows that Facebook is being hacked? How many of your Facebook sudah kena hack? How many of your Facebook already being used to communicate with friends and say, I'm your friend, can you send me money? You know what I mean? So how many times have that happened? So if your Facebook can have that problem and your bank account can be hacked, medical device can be hacked. So there is a major issue with medical device cybersecurity, and we need you to understand that. This is when this is this year I think, or from yeah. So we have actually 173 medical device cybersecurity alerts, and we publish these alerts every Friday. And we have 173 of these alerts just on cybersecurity. We've got other problems alerts also. You can see we have also workflow management problem and all that. And Lock Shell 4 is here, and we will talk more about that. But we have all these kind of problems, and you really want to think about cybersecurity for your medical device. Some of the areas where things are happening and that you are not aware of, updating, when they update the medical device, when they look at when they substantiate the medical device, look at the what the manufacturer claim in terms of safety. These are areas that you want to look at. We have seen a lot of ransomware. You want to be very cautious and you want to be aware of those issues that are happening. I'm going to jump straight into the problem I talked about, some key recommendations, and you need to really implement a security program and then develop an incident response plan. Ladies and gentlemen, this one everybody also know. But behind this, to achieve this, here is the key thing. If you do not understand your problem, your risk, and your risk with individual medical device related to cybersecurity, how do you plan? How do you implement any security if you don't even know where the attack and where the problem is? So first, go understand where your risk and your problem is. Then you can actually come up with security plans and all. So another round just to go through the 10 so that you can see this. As we have mentioned, you can download it from our website for free. You can go read them in the, on that part. I know I take a lot of time. Thank you very much. And I'm so sorry that I've expended the time that was given to me.
Okay, thank you very much, Mr. Eric. And I hope you all enjoy this amazing presentation. Now we will go ahead and take some time for Q&A. Just a reminder, please be sure to type your question into the question box in your control panel. So first, I would like to check the question. If I'm not mistaken, we have question from Mr. David just now.
Let me check. Also open those.
Yeah. Can share what type of face mask and the relevant standard ASTM, KF mask, etc.
What is the question?
From Mr. David, can share what type of face masks and the relevant standards?
Or the relevant standards for face masks. Okay. Yeah. For COVID or for regular use? If it is for COVID, refer to NOISH, NOISH. So if you want to use for COVID, refer to NOISH standard. And if you go into I don't know whether it is publicly available. We did a mass punya testing, and we took some samples of some KN94 and KN95 versus N95 and all that kind of thing. So we did some comparison, and you can have a look at those reports. Some of you who have access to our membership, you can see. I'm not sure if it is still in our COVID center site or not. ACRI has a COVID center site that is also free for the public. If you go into ecri.org, look for the COVID center site, and you may be able to find it there. So we've done something like that. We also talk about what are the considerations that you can, sort of like the criteria, because what is available in the US may not be the same product that is available here, especially you talk about masks, right? So you want to just understand some of the criteria so that you can look at it when you are trying to assess the mask in the future.
Okay, and the next question is one from my friend. Does ECRI have a database on comparison of medical devices?
Yes, you ask Mr. Lau, he knows it. Banyak sangat. You can ask him to show you. He has it. He has a data. He has access to our.
How do you know, Mr. Eric?
Because he's using it. I know he's using it, so he has access to our database. So yes, we have a comparison. I think we have plenty from all kind of medical device you want to compare. Compare company to company also have, so you can go and compare. So you want to compare ultrasound, for example, you can compare company A, B, C, D, E. There will be a comparison chart. You can actually just access that and you will be able to see. And that comparison will also give you a lot of specification information that is related to that particular device. So you can go in and have a look.
Okay, let me check again. I think
Thank you,
I covered.
That's the resource center, yes.
I think I covered already, right, Benedict? I covered all the question, right?
Yeah, all questions are covered.
Okay.
Ini Eric purposely jual nama saya.
Ada jual nama you lah. Your number very harum already. You're not gonna
very harum already.
But the truth is the truth. If they need information, they need help.
Sure.
People can try and access. And thank you now for sharing this coronavirus punya website or our resource center, our COVID resource center. There's a lot of free information inside related to device, process, consumables that are related to COVID-19. You can still go in. It's a free site. You can still go in. We did a lot of research. I think the latest one is on vaccines also, so you can also go in and have a look. some of the information that we publish for free. Those who wanted the comparison, like, oh, can I compare this company mirror device and that company mirror device? I don't want you to pay a bit because we're all not-for-profit, right? So we also hope that more people will subscribe to our information and our research work so that we can continue to have some money to go and do this research. If not, then if we don't have enough funding, we cannot continue this research and we cannot share things with you guys anymore. So that's what we are. Thank you. Thank you. Okay.
Okay, it's look like we have covered all questions. So, Mr. Eric, is there anything else you wanted to cover before we wrap up?
No, thank you very much for inviting me. I'm very, very happy and glad to be here, and hopefully I've shared something valuable for you guys. If there's any question, please contact me. Do not hesitate to give me a call. Thank you.
Yeah. Okay, thank you, Mr. Eric. So now I would like to invite our chairman, Association of Professional Technicians and Technologists, APTT IRTS Ahmad Zawawi, to present the certificate to our presenter, Mr. Eric Wu. Please.
Okay. How do we present this?
Session.
Virtual session. So I should like take my hand and
Need to shake hand.
oh, need to shake hand. Okay. Left or right? Like this. Or should I turn this way? So,
where's Encik Zawawi?
Yeah, where is the Encik Zawawi?
I see Kismet here.
Oh. Where is everyone?
Okay. If Zawawi I think Zawawi may could not make it, maybe we invite Mr. Kismet lah.
Okay, please welcome Prof. Kismet.
Hi.
hello. So I'll shake my hand this way. So that shake your hand that way. Next time I will come to Kuching and we can shake hand officially there.
Oh, yeah.
Next time I'll come to Kuching. I always tell Lau I always like to come to Kuching, but I haven't find enough excuse to go there. If I always want to fly there, the company, my boss will say, hey, why you always want to go Kuching? A holiday are you? So I must find enough reasons to go there next time. Next time I'll come more. And you can see my colleagues on the screen. Lau, Damish wants to say hi.
Hey, Damish.
Hey, hi Lau, how are you?
Fine.
After
Okay.
1st April, then you are most welcome to Sarawak.
I'm always happy to come to Sarawak. Next time I come to Sabah, Sarawak, I will make sure I stay for 2 weeks, then I come back. If I can.
Too long.
I want to enjoy the Sabah, Sarawak, Sabah, Sarawak punya, what do you call, the environment is something that I really like to enjoy as well.
Yeah, especially exotic food.
Yes. No. Exotic food has a rate. I dare not say no already. Last time I kena one time exotic food. Okay. Tolong. Tuak, no problem. But exotic food is something. Okay.
Mr. Lau can bring you to Rumah Asap.
Okay.
Boleh.
Okay. All right.
Damish jauh. Suruh Damish tenang sekali.
Yeah, where is the certificate just now?
Okay.
Bernadette, where is the, yeah. Oh.
Wow. Thank you so much.
Okay, thank you very much.
Thank you so much. Thank you.
Yeah.
Thank you so much.
Thank you.
For today's webinar, yeah. On behalf of APTT and also our chairman, we would like to thank you that you volunteered to be our speaker for today's webinar.
Very happy to do so. Yes. I hope to come to Sarawak and Kuching and see you guys.
Yeah, sure. Just
Thank
give
you.
us. Yeah.
Oh, group photo, Mr. Lau. Okay.
Yeah.
Look for Mr. Lau, and Mr. Lau will can connect you and me later.
Okay. Can.
Okay, for the photo session, I would like to invite everybody to switch on the camera for our photo session. So please, Bernadette, can you please take the photo later on?
Yeah, I'm in my lab now.
So.
Are you sure that is your lab? I don't think that's a lab. I think that's Rumah Asap.
Oh, at lab. Oh, okay. Long time no see lab there.
Yeah. You're most welcome. No worries.
Next time must go visit your lab.
Oh, sure. You're most
Can
welcome.
collaborate lah. The lab testing.
Mm.
Oh, yeah.
Next time when you guys come to Kuala Lumpur, please drop by in our office area. We will show you our lab. And now, as we speak, our research lab is now testing ICU ventilator. So we have 2 models in there, some more coming. So the next one we are going to test is oxygen concentrator. So we're going to test these two devices, and more is coming actually. So if you're coming by and you all have time, drop by in our lab just to see what they are testing there.
But it sounds scary when you mention our ICU.
No lah, it's the ventilator that we are testing. So it's a very important device for the ICU. So that is why.
Yeah. So any photo session?
Okay.
Waiting
Okay,
for Bert.
Bernadette, it's over to you for the photo session.
Okay. Okay.
Thank you.
Everyone ready? Okay. 1, 2.
We have about 76 participants today.
Wow.
Thanks a lot for the support. Thanks a lot, Mr. Eric.
Congratulations.
Okay, one more time.
Okay.
Is there any counting, Bernadette? Or you forgot to count?
Cannot
1,
hear,
2,
is
3.
it?
No lah, her voice so too soft already. I think she's wearing triple of four layers
Sudah
of
makan ke, Bernadette?
mask.
Sudah makan ke belum?
Hello, Syaf.
Okay. Paling
Next time I
ngakak?
belanja you, follow me lah.
Dapat.
Boleh. Okay. 1, 2, 3.
Hello, Cikgu Petrus.
Okay.
Okay, thank you so much. Bernadette,
Go
can you?
Korea.
Oppa style. So, Bernadette, can you send a copy of the photo to me as well?
Okay, sure, no problem.
Yep.
Thanks, Ben. Thank you.
Yeah.
Okay.
Thank you, everyone. Have a good day.
Thanks,
Okay,
Eric.
thank you. Thank you, Mr.
attendance
Eric.
link and the
Thank
QR
you.
code soon.
Come, Mr. Eric.
Okay,
Okay.
thank you so much. Bye-bye.
Okay,
Yeah,
thank
thank
you.
you.
Bye.
Bye, Eric.
Another
Thanks,
2 weeks.
Eric.
Bye.
Bye-bye.
Next question, Petrus. Petrus. Renjatan.
Yes.
Petrus.
Next
question, Petrus. Renjatan.
Yeah, Petrus will be the next moderator, right?
No. Cikgu Kipli. Cikgu Kipli. TS Kipli.
I bagi
tunggu.
tahu Mr. Lau just now.
Mr.
Kismet
Petrus
kasih
can
mu
be a
I
speaker.
lagi.
Especially on the water heater.
Okay. Ismail. Ama kita jealous lah. Yang ada kita tukar moderator. Yang maju.
Apa? Merajuk tua-tua, merajuk indah.
Okay, I will post the attendance link as well in the chat box.
Yeah.
While if you are not able to scan the QR code, then I'll put up the link in the chat box, or maybe Ben, siapa lebih cepat lah.
Ya, kami ada
Okay.
ada 3 handphone ya, Pak. Macam lah handphone.
Boleh kah kami scan handphone macam tu? Oh, dapat. Oh.
Utak kami paste lah. Oh, Master Syafiq, kau memang cepat Syafiq.
Betul.
Okay, Cikgu Petrus, next one kita
Speaker.
Kami jadi model kita lah, kami mandi.
Okay. Nanti kita discuss. Dr. Kis, memasak kita sebut dah.
Apa tu telecommunication evolution survey form? Betul kan ni?
Yome?
Yes. 25th. Tarikh betul, nama salah.
Ya Ben dah ya. Macam ni Ben
okay lah, no
lagi
problem.
palau kali ya.
Dah short dah. Short.
Apalah.
Oh, ni kena renjatan ya, Bo.
Okay, dah tukar.
Okay, no problem. Not a big deal.
Oh, siapa? Jadi
Nampak.
nama ada settle.
Ya.
Okay guys,
Okay.
see you again.
Okay guys, thank
Okay,
you
bye,
very much.
Petrus.
Okay,
Bye.
thank you everyone. Bye.
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 See you.
Bye.
Ada kita punya next speaker di dalam tu juga.
Siapa?
Nya tengah pola slide lagi. Nya mau
Iya.
mengajar kita on hemodialysis machines.
Okay. So another 2 weeks, right?
Oh. And I think nya pilih the second session of April lah. Maybe that means 4th week of April lah.
Okay.
Ada yang nam tu.
Because we will assign a new moderator lah. Give chance to others juga jadi moderator.
Iyalah, amoy kita merajuk, Matt. Kau si kelakar betul-betul. Merajuknya dengan kami. Yang madanya semua katanya.
Ay, mahal macam ya. Okay.
Oh, kami belum lagi isi form. Ya Rabbi, kakak aja banyak. Isi form juga.
Kami tengah isi lah tu. One by one.
Isilah. Kami pun isi je lah.
Okay.
Okay. Bye, see you.
Okay, see you.
Okay. Ben, terpaksa tunggu sampai habis lah, Ben.
Yalah, siapa?
Siapa apa kata kawan kami, orang yang sabar selalu comel, ba? Sikit, Matt.
Betul. Betul aja lah. Yang penting rumah asap.
Ya, rumah asap bila?
Kelak lau katanya.
Okey, boleh.
Itu nama dijual ya. Satu suruh Petrus atau deh.
Macam ni nak tutup tu.
Dah.
Okay, bye-bye.